All right, we are back. Body Shapes Medical. Leesa Innenbach is here, and we're joined by a nurse practitioner that works. I talk about the great staff they have at Body Shapes Medical. This gentleman is certainly one of them, and that is Branden Leesa. Branden, welcome to the show.
Thank you, John.
Thank you for coming in. Now, Branden, you are you're a hormone expert. I guess I know you're much more than that, but a hormone expert. Tell us, you know, testosterone isn't the only thing that you need to address at Body Shapes Medical, correct?
No, we check quite a few different hormones at Body Shapes, particularly for men and women. There's certain hormones that everyone needs to have normal, and they all need to be elevated beyond normal for them to really have the type of outcomes that we really want to see as far as disease prevention and making them feel better.
You know, we heard from Klaus. Tell us about some of the patients that you see and the reaction that you get as far as after they've been on some hormone therapy for a while. What kind of things do they say to you?
Well, men particularly, we notice that they actually have a lot of sleep issues, and that their sleep is much more improved.
Good.
Initially. Of course, definitely libido, energy, all of those things. Women as well. Libido is big with women after the age of 40, as well as some fat loss and some things like that. So really that's our focus, is really trying to make them feel better holistically, and and you need all your hormones to be level to do that. So
all right, Branden, and when he says holistically, everything. You want to feel the energy, youthful, the whole, sleep well, everything.
Right, and there's a big picture. You know, there's a lot of places out there that they'll just do testosterone, or they'll just do estrogen and progesterone for women. We like to focus on everything. We talk a lot about thyroid. The thyroid is a hormone. Vitamin D, that's a hormone as well. A lot of people don't focus on that. Vitamin D alone can decrease your cancer rates by 50%, studies have shown. So again, we want to look at everything. We want to look at the whole picture. Maybe it is just testosterone or estrogen, progesterone that you need, but maybe it's not. Maybe it's melatonin. Maybe it's DHEA. Maybe it's vitamin D. And again, come on in. The consults are free. Let's go over everything. Let's go over the full picture and let you know what it is, A, that you're deficient in, and B, that we can help you with. It might take a few months to get you feeling better. Your hormones did not decrease overnight, so we're not going to be able to increase them overnight. But guess what? We're going to get you feeling better initially, and then we're going to get you feeling great within about 6 to 9 months. And then we're going to keep you on some therapy. And you may or may not have to do the same hormone therapy for the rest of your life. People ask me that all the time. Will I have to do this for the rest of my life? Probably you will have to do some kind of hormone therapy for the rest of your life to keep yourself feeling good, because your hormones are going to go back down if you stop treatment. But again, we look at everything. It's not just 3 little hormones that we look at. We look at the whole picture, and we don't treat the blood work. We treat the patient. All
right, nurse practitioner Branden Leesa, of course, Leesa Innenbach, who is also, you're an RN yourself.
I sure am.
Yeah, so we appreciate all the expertise here, and we're going to go to the phones. You mentioned cancer. You said the word cancer, and we have a question, I think, in that regard. Martha is with us from right here in Louisville. Good afternoon, Martha.
Hello.
Hello, Martha. You have a question?
Yes. I don't know if she can do anything to help me or not. I'm 66, and I had ovarian cancer when in '04 when I was 58, and I stay hot. I have hot flashes constantly. I can't, anything I try to do, I just sweat so bad. And I didn't know if you had any kind of hormone that I could take. I know since I had cancer, my doctors won't give me any hormones or estrogen. So I didn't know if there was anything you could help me with.
I'm going to let Branden address that, if that's okay, Martha.
Martha, when did you have ovarian cancer?
2004, I had surgery.
2004? Okay. And did they remove your ovaries?
Yes.
Okay. You have an estrogen deficiency, and that's really why you're having all those hot flashes. You probably have some bone demineralization as well related to that estrogen deficiency. More than likely you have some progesterone issues as well. So if you came in, we could definitely help fix that.
Yeah, and I know safety first, right? You probably work in tandem with her doctor, make sure she's okay, sure.
Definitely. We do have to be really careful with cancer patients. I mean, Martha's a candidate because she did not have cancer, or had cancer back in 2004. We like for you to be at least 5 years out. But again, we are going to sit down with you. We're going to talk to you, Martha. We're going to make sure we work with your MD as well and make sure it's safe before we proceed with anything.
All righty. Thank you for the call. Phone lines are open, 571-5263. It's Feel Good Friday. We'll be right back, and you will feel good. Body Shapes Medical. We shall return.
Young.